I joined Mount Sinai Queens at the end of 2013 to become Chief of Orthopaedics at Mount Sinai Queens. This was after 24 years at Elmhurst Hospital, which is a level 1 trauma center. At Mount Sinai Queens, I see my patients every day, unless I'm out of town. We do have physician assistants, and they're a key to ensuring that patients are seen 24/7 and that there's continuity of care. But we don't have the problem of having residents and doctors that are on shifts that come and go that don't know you. So I think in that way I'm enjoying being able to take more personal care of my patients. At Mount Sinai Queens, we do a variety of orthopedic surgeries. We do joint replacement surgery. One of my favorite operations is hip and knee replacements. It's very routine at our hospital. We do several a day. It's one-stop shopping for the patient in terms of their pre-testing. They come to the hospital, get maybe a week or two before their operation. They get their blood tests, their EKG and chest x-ray. Those results are reviewed by myself. You come to the hospital the same day of your operation. You get your rehab at the hospital the next 2 days. It's usually bedside rehab twice a day. Safety is a big concern for us, and we're always promoting safety for the patient and for the whole experience in the hospital. Usually after 4 days, you're off to a subacute rehab center to continue your rehabilitation. One of my most memorable experiences at Mount Sinai Queens is being able to do bilateral knee replacements on the same patient. In fact, I've done that twice now. In the past, if we did bilateral knee replacements in one sitting, that would be a lot of surgery. So what we were able to do at Mount Sinai Queens is perform one knee replacement on a Tuesday, followed by the second knee replacement on a Friday. That seems to be much safer for the patient. The patient's recovery ultimately is shortened by almost half the time. Both patients are doing quite well and are very pleased and are very thankful that they were able to get both knees done in one hospital admission. My patients have told me that a knee replacement has been a life-changing experience. In terms of relieving their pain, some have told me they almost have no pain after the operation. The operation is basically a resurfacing of the knee joint. You have to make an incision, obviously, and do a little carpentry on the knee. We replace the surfaces with metal, with a plastic liner, and more metal. This metal is either cemented into the bone or press-fit into the bone where the bone actually grows into the metal. Hopefully this replacement will last a good 15 to 20 years. And a lot of the recovery, though, does depend on your rehabilitation. So you do have to do your therapy and exercise, and it could be a life-changing experience.